Hello, Betty. My name's Irene. I'm a psychiatric nurse practitioner. Nice to meet you. I understand you've been experiencing some anxiety. I'd like to discuss two medications with you that are often prescribed for anxiety, and then we can determine which one's the better option for you, okay? So the first medication is called Buspar. Buspar is the brand name, and the second medication is clonazepam. The brand name is known as Klonopin. Both are very effective for anxiety, but only Buspar is actually FDA approved for generalized anxiety disorder. Klonopin is approved for panic disorders and seizure disorders, but it is often used off-label for anxiety. The way Buspar works is not fully understood, but it is believed that it works through decreasing these neurotransmitters in your brain called serotonin and increasing the amount of free circulating serotonin in your body. Clonazepam belongs to a drug group called benzodiazepines, and they increase the amount of this neurotransmitter called gamma aminobutyric acid, GABA for short, and this neurotransmitter is responsible for calming effect, a sedating effect, and muscle relaxation. So we need to discuss some risks and benefits associated with each medication. I'll start off with the Buspar first. So some benefits of Buspar: it is non-sedative, it is not addicting, and there's no withdrawal symptoms associated with it, so that's good. Some drawbacks, however, of Buspar: it does take 1 to 2 weeks to actually feel its therapeutic effect. It might not be as effective in patients who have already taken benzos in the past for anxiety, and also should not be combined with the medication Lexapro, which I understand is a medication you're currently on. If you combine those two medications, it could increase your risk for a condition called serotonin syndrome, which essentially means there's just too much serotonin in your body, and it could potentially be fatal. Some benefits of Klonopin: it is quick acting and it's potent. Some cons of Klonopin: it is addictive, it is sedative, and it also can decrease your respiration rate, and it is also not recommended to be abruptly stopped. It is within 3 to 5 days of taking. If you stop it abruptly, 3 to 5 days after that, you will experience some severe withdrawal symptoms, and it should not be taken for more than 2 weeks because it is highly addictive. I'd also like to discuss some side effects associated with both medications. Buspar has mild side effects compared to some of the other anti-anxiety medications. The most common side effects of Buspar is nausea, dizziness, headache, nervousness, and jitterness. Some other possible side effects that are less common with Buspar include blurred vision, tinnitus, chest pain, abnormal dreams, gastric distress, and muscle weakness. These side effects can further be exacerbated with grapefruit and grapefruit juice. So if you decide to take Buspar, it's best to avoid anything related to grapefruit, any grapefruit juice. The most common side effects associated with Klonopin is lethargy, fatigue, confusion, dizziness, motor impairment, and ataxia, which is a loss of muscle coordination. Less common side effects of Klonopin include blurred vision, confusion, loss of libido, psychomotor agitation, and some amnesia. The good thing about both of these medications are it does not require any monitoring, and they're both pretty effective for treating anxiety. From the two of the medications, I professionally would recommend Klonopin. The reasons I would recommend Klonopin are you have taken Ativan in the past. Studies have shown people who have taken benzos in the past don't respond as well to Buspar. You're also currently on Lexapro. As I mentioned before, Lexapro and Buspar should not be combined as it could increase your risk for serotonin syndrome. And also Klonopin is effective for treating acute symptoms, and you are currently experiencing feelings of panic and anxiety, and Buspar can take up to 2 weeks to have any relief. The downside is Klonopin should not be taken longer for 2 weeks, so if you do decide to take Klonopin, I do recommend that you come back. We schedule an appointment, you come back in 2 weeks so we can reassess you and determine if you're still experiencing anxiety, if we can get you on a different medication that is not a benzodiazepine. Do you have any questions or concerns about either one of these medications?